Hello and welcome to the 2024 Endometriosis Australia Symposium. I'm Kendall Gilding and we are so glad that you could join us. We're going to hear from experts in the field of endo and fertility and also hear the patient perspective of this disease, which impacts almost 1 million Australians. First up, let's hear from Endometriosis Australia Ambassador Christie Whelan Browne and her husband Rohan Browne.
I first noticed my endo symptoms through having cysts bursting on my ovaries. That's when it sort of was like, something's going on here. But probably there had been symptoms prior to that had just been ignored, but it was the bursting of the cysts that really got, it really got me exploring what was going on. I had my first laparoscopy when I was, I think, 27 or something.
About that, 28, 27.
Yeah. 28 or 27.
Around then.
Yeah, and I woke up from the surgery. Like most women, the first question I asked was, did you find it? Because there's such a pushback against, well, it's a big step to have the surgery. Are you sure the symptoms are as bad as you feel? And so you question whether or not you should go through with it because it's quite invasive. And so a lot of women wake up wanting that reassurance that they made the right decision. So I opened my eyes and said, did you find it? Yes, we did, but we couldn't remove it because it was wrapped around my bowel and they couldn't get to it. So I was sewed back up and told, you need to have another surgery. At which time it just wasn't an option, taking 6 weeks off work. I couldn't do it again because I'd just done it and there'd been no results. So I went on a birth control, the NuvaRing, which was the best one for me, and I stayed on it for about 8 years, and that was my management. I just tried to ignore it, basically. Part of me was so validated, even just being told I had it. Even that alone was enough for me to say, okay, I'm not imagining this. I'll treat it with this contraception because it was the simplest solution. It was not invasive, and I put it off as something that we'll worry about later, which I deeply regret because then what came later was wanting to have a baby, and then more problems appeared because it had been ignored for too long. On the contraception, I was still experiencing symptoms, but nowhere near as bad. This really worked for me, and I didn't have any more cysts. Maybe a couple, maybe little ones, but yeah, it was good.
But it kind of gave you your life back in a way. You weren't in so much like intense pain when you would have your period, and I think that was enough for you to kind of stay on it for so long, not realizing the repercussions down the track with, where we ended up trying to have a baby.
It was a very specific time period where we decided we were ready to have a child. I stopped with the contraception, and we were just so naive, and we kept thinking every month, oh, I think this is it. I think we're pregnant. And it was
straight away we felt like this, we were overseas and we had this whole plan, this kind of romantic plan of how it was all going to happen. And again, very naive that we thought that she would get pregnant within the first 3 months. And every month we were met with disappointment about not being pregnant and realizing that there were other things at play that were hindering Christie and myself, like having a baby.
Yeah, little did we know 3 months was...
that
was
so
a walk
naive,
in the
so
park.
young.
Yeah.
Yeah,
but it was quite a shock to, and that's why I tell every young woman that I work with, don't ignore your period. One day you're going to need that period. You're going to track that period, and you're going to follow it to the day so that you can try and make a baby. So we need it, and we need it to in so many ways. So yeah, don't follow my path and ignore the issues, because one day that period that you either skip or it's the only way to make a baby.
And I think when you're younger, you don't have the education about needing the period. So it's all about, curbing getting pregnant because I'm too young, I want a career, or whatever your reasons are, that the implications of taking contraception and what it does to your period cycle, and then with all of the diseases that you can get, it's, the education just isn't there, I think, because it's all about don't get pregnant.
Yeah, we're all so afraid of falling pregnant in our 20s, and we were like that as well. But at 35, when we decided it was time, that's when, reality hits. Yeah. Well, I had been told that fertility could be an issue with endometriosis, and I don't know what it is. Is it privilege that I was like, oh, we'll be okay? And I don't know where that blind faith came from, but as it turned out, I went to follow up with an endo surgeon who did a lot of tests and found stage 4 endometriosis wrapped around my bowel, removed it and said, you have no eggs. And I was like, okay, so what does that mean? And he was like, I suggest IVF immediately. And he said it with a big smile on his face, and I was in a real state of shock, like, oh, well, we were never going to go down the path of IVF. And until you're told that is your only option, we very quickly decided that was the route we were going to take.
Yeah, and again, talking about education, we didn't know that the eggs don't generate like sperm does. For men, it's just, constant kind of reproduction of it. We didn't know that women are born with a certain amount of eggs, and as you get older, they kind of dwindle. They go with the periods. And so we got to a stage where we tried to get pregnant, and Christie had very, very limited eggs, and we were forced, our hand was forced. It was like, well, naturally isn't going to work. We have to now let science do its job, because we'd been trying for, I think at that stage, maybe 3.5 years, and it wasn't working. We were getting older. So we were
You were, I wasn't.
Correct. Our hand was forced because we really wanted to have a baby.
Yeah, it also solidified that idea. We'd never been 100% on having a baby, or we'd never been so sure until he said to me, you're infertile. And then it all became crystal clear that was my goal. I wanted to be a mum, and I was willing to do whatever it took to make that happen. In our first few rounds of IVF, we couldn't get an egg. And it was just like, when you go through IVF, if you've been through it, you know that the hormones and the injections, the drugs are just, they're hardcore in every way. So to get no egg at the end for 3 rounds, that was just soul destroying. Yeah. And we started to look down the avenue of an egg donor, or, we started going down a path we never
discussed. We were again forced into this corner where it became apparent that we were not desperate to have a child. We always said that we were enough, but that we really had, emotionally gone through all of those kind of peaks and troughs of every month, kind of not getting pregnant, that we realized actually we really want it. And so what are our other choices? And that was, we kind of organized an egg donor. And we got ourselves into a situation where I think it took the pressure off Christie, because we had an egg donor. We had our new IVF fertility doctor that we said we had one last chance at doing this, so that we had this egg donor lined up, and she said, just do it one more time. Just one more time. She goes, if I don't fertilize it, you don't have to pay. So I think we had all of these kind of things where it took the pressure off Christie. She was like, okay, well, if it doesn't work, it's, I think for women, they find that it's their fault. It's hard to not, you just feel this responsibility that my body just doesn't do what everyone else's does. And so you kind of take that on board. So I think it took that pressure off Christie to be able to just live in it. And COVID happened. So, she wasn't so stressed at work. So there were all of these things that just aligned for us to get our brilliant baby.
But yeah, there is a real shame around not being able to produce an egg. And that's silly. I'm born with this amount of eggs. It's not my fault that my egg count was at 1%. Like, that's not my fault. But it was so shameful. And I remember thinking, if I get an egg donor, I won't tell anyone, because that would be so shameful to not be able to make a baby with my own egg. And then I started to read all the research that said, no, you would need to tell this baby as soon as possible that they are from an egg donor. And I was like, wow, I'm going to have to deal with all this and work through the shame of it. But yeah, this fertility doctor that came along and gave us this last chance, she got one viable egg that made one embryo that made our son. And to me, he's a miracle, and he'll always be a miracle, because I know what women go through, rounds and rounds and rounds, and they never get that embryo, or they do, but that won't stick. You know, I know how lucky we are. And it's not through us. We were just lucky. Yeah. We were just very lucky.
Yeah, because there's thousands of parents who want it, who probably wanted it more than us. You know, it doesn't mean that you're going to get it. Like, it took us a 5-year process, multiple rounds of IVF, and we're thankful every day, even when he's being, naughty. But the other great thing about Christie too is she's a great advocate for any young female that she's working with, that she's like, go and get your eggs counted. And if you have low eggs, freeze some. Like, I wish I had have known when I was in my 20s that somebody had the information to let me know that you have a limited amount. So many women that she's worked with have done that.
Yeah, I just think that information is power, and we don't know. We're going through life. We don't know that that's happening or not happening inside of us. But there's this one simple test. It costs $80, and everyone should do it if they want to know, or they think they may want to be a parent, or if they aren't sure. It's simple, and it's $80. Yeah.
We've got friends that have frozen their eggs because of what Christie did. It's kind of sparked a fire in a lot of people to kind of just do it.
I say to my friends now who are doing IVF or struggling to fall pregnant, I remind them that there's nothing that you can do or not do to make this work. So you can have just 2 coffees a week. You can have no wine. You can do everything right, and it still might not work, and that's not your fault. Yeah. And if you have negative thoughts around it, like when that one embryo was put inside of me, I thought, this isn't going to work. I knew it was a low-grade embryo. I just didn't believe. And Rohan spoke to my tummy every day. He believed. And so I say to my friends who have had an embryo implanted, if you don't believe, it's okay. I didn't believe, and he still stayed.
Doesn't make you a bad person, or doesn't, we go through all
It doesn't change the outcome. No. And we think it does. I used to think that my thoughts were ruining it, or the amount of self-blame involved in this process is horrendous. So I like to say none of it is your fault. If it happens or if it doesn't, it's not your fault. And you can have a beautiful life either way, with or without a child. I want you to remember that, because now on the other side, I do see that. I do look back at Rohan and I, and I see us in that fight to have a child, and I think, I wish I had told myself, you can have a beautiful life either way, because the pressure of I can only have a beautiful life if I become a parent is debilitating. That's my feeling.
Yeah, and the education, I think everything that, surrounding like IVF and surrounding Endo, I think there's some incredible information that's out there for everyone to kind of read up on and know, and to give you that kind of relief that there's so many people out there who are going through their own journeys as well, and that, you can lean on your friends, you can lean on other people, lean on the, experts and stuff, and it's a hard journey, but it's an incredible journey.
Yeah, and in terms of endometriosis, trust your gut. You shouldn't live in pain. And if someone's telling you that it's normal, or that that's just a period, you can find someone who will give you another outlook on that. And I was so lucky. My GP that I saw, my very first male GP, had 2 daughters, and he was incredible. He was such an advocate, and not everyone has that experience. So I think keep searching till you find someone who's listening and who wants to help you.
A big thank you to our ambassador, Christie, for sharing her story so candidly. It's often said that there's someone out there with a wound in the shape of your words, and we really believe there's a lot of power in sharing our stories in order to strengthen our endo community. So again, a huge thank you to Christie. I'd now love to welcome the Endometriosis Australia Medical Director, Associate Professor Anusch Yazdani. Anusch, does everyone that experiences endo go on to have fertility issues?
Well, actually, it's a surprisingly difficult question to answer. And the reason for that is not only because we're looking at different populations, and it really depends on whether or not the diagnosis of endometriosis has been made at the time of surgery, or whether it's been self-diagnosed, or whether it's come by implication, but really also because, like pain, there are lots and lots of different reasons for why people have problems falling pregnant, and at least half of them are related to the male. So if we look at our current data, we know that about 1 in 7 women will be diagnosed with endometriosis, and about 1 in 6 couples will be diagnosed with infertility. So there's a massive overlap between those two populations. If we look at my clinic, in our clinic, we would say that about 40% of women will have endometriosis with infertility, and if they have pain as well, it's almost 60% of women. So overall, taking all of that into account, we think that somewhere between 1 in 3 and 1 in 2 women who've been diagnosed with endometriosis will have fertility problems. But there are also some issues that happen afterwards. So we know that women with endometriosis are slightly more likely to have problems early in pregnancy, like pregnancy losses or ectopics, and potentially also bleeding later on in pregnancy. And there are a number of reasons for that. Endometriosis has a number of effects on fertility and on reproductive outcomes. Firstly, and that's the one that most people would think about, is that there's a distortion of the anatomy in the pelvis, which then makes it difficult for the sperm and the egg get together. And that's the one thing that people usually think about. But there are actually a whole lot of other factors. One of them is that the environment in the pelvis is quite inflammatory and is not so good for the egg, and it causes abnormal ovulation. And lots of women who have endometriosis have abnormal ovulation. The sperm interaction with the egg is also altered because of the inflammation. We know that there are significant functional differences. So the uterus behaves differently. That's part of the reason why there's all that cramping and the pain when women have periods. And the tubes work differently. But also the genetic predeterminants are that women also have problems in responding to certain hormones, like the progesterone and estrogens are quite different. Finally, we also now know that women with endometriosis have a reduced ovarian reserve. And it's one of the reasons for why, even if all of the endo is removed, fertility doesn't ever quite go back to normal. Of course, some of the treatments that we give women, like the oral contraceptive pill, are all cause fertility problems while you're on it. So it makes sense that women who are having active medical treatment for endometriosis would have problems conceiving. And of course, the last element is pain. If your life is full of pain, then you're not going to want to have sex in order to have a baby. Now, pain with sex is a really difficult determinant of all of this. So for all of those reasons, there are significant issues that women might experience conceiving. But it's important to remember that at the end of all of this, not everybody will. And in fact, the majority of women who've been diagnosed with endometriosis probably will not have any problems conceiving, and definitely will not have to have a major intervention like IVF.
So the great news is that just because you have endo doesn't mean you are going to struggle with fertility. Tell me, what are the latest advances in detecting fertility issues?
Well, one of the greatest advances that we've had has really been around the quantification of the possibility of pregnancy. So really we're now looking at some of the predictors of whether or not there is actually going to be an issue in the long term. And this looks at things like tubal function, and we can now assess that without having to do surgery. We do this through ultrasound scan or through X-ray. We can now look at ovarian reserve, and that can now be easily done by doing something like a blood test, and that's called an AMH, and that's become very popular, and it's part of our routine assessment in fertility patients now. And then of course we're now focusing more on the male as well, because male fertility is reducing all around the world, and it's now a significant predictor of whether or not a couple is going to be able to achieve a pregnancy. In terms of the assessment of ovarian reserve, this has now opened up a whole lot of other options for women who may not want to be pregnant at this point. And so of course that then allows us to predict and offer solutions for women until such time as they're ready to conceive.
So with that being said, what treatments are available for women who have confirmed endo and are looking to improve their chances of falling pregnant?
Well, the first port of call always has to be lifestyle. And so part of that then is making sure that you're living a healthy life, that you're exercising, eating a balanced diet, and seeing your GP for the general sort of preconception consultations. Historically, all of the assessments have been done through surgery. That's how we diagnosed endometriosis. That's how we treated endometriosis. And really, it still remains the only proven way of increasing your natural chances of conceiving. But we've now altered the way that we're approaching endometriosis, surgery in particular as well. One of them is we are now much more, for want of a better word, gentle with the ovaries, because we know that ovarian reserve is reduced in women who have endometriosis. So we want to maximize fertility potential while at the same time reducing the chances of recurrence. The second thing that's happened is we're now doing more of an assessment of the overall pelvis, looking at the tubes, looking at the uterus, looking for other conditions like adenomyosis that may be involved in terms of fertility. So the new thing that's emerged is that really when someone's diagnosed with endometriosis, we're encouraging women to actually create their own personalized fertility plan as to what's going to happen if and when they choose to fall pregnant. And so that would then mean in women who don't have endometriosis, we would normally say under the age of 35, if you've been trying to fall pregnant for over 12 months, you should be seeking help. In most women who've been diagnosed with endometriosis, we would say, look, after 6 months, we would assess. Doesn't mean that you'd have treatment immediately, but we would certainly start assessing fertility. And again, looking at those other elements like your partner. And then the last thing, of course, that may be that if there is actually a problem with the tubes, we may actually not recommend trying at all, because if the tubes are blocked or if something else is there, that you then have a plan. Part of that plan would also be then minimizing the impact of anything else that you have, making sure that your pain relief is under control, that you are able to have sex, because pain is going to interfere with your capacity to conceive naturally. And then finally, of course, making sure that you're not taking any medications that may interfere with your chances of conceiving. So again, it's really important for women who have endometriosis is to create a plan and to have an idea of what's going to happen once they do want to fall pregnant. And that doesn't necessarily mean having to do IVF. We now have lots and lots of other options available, and they go through things like flushing tubes, insemination, all of which are really effective. And for those women who have been diagnosed with extensive endometriosis, our higher level interventions like IVF are now so effective that we can actually mitigate a whole lot of the effects of endometriosis. Not quite, but almost.
Well, thank you so much, Anusch. You've perfectly described my personal journey with endometriosis and then following down that path of a fertility journey. Information's really powerful for our community and for our endo warriors who are trying to navigate this. You're at the forefront of all of these advancements happening in this space, so we really appreciate your expertise. Thank you so much for your time.
Thank you.
Well, we've heard a medical perspective from Anusch, and now we'd love to welcome a couple to share their story, Mike Goldman and Bianca Zouppas. Thank you so much for being here. Bianca, when did you first become diagnosed with endometriosis?
So Mike and I went in to see Dr. Anusch about our fertility journey because we'd been trying for a while. And obviously you do a lot of tests, and I kind of explained some of the symptoms that I was having, and he, you obviously can't see endometriosis unless you have the full surgery, but from the scans and from what I had told him, he said, it sounds like you might have endometriosis, but we can't tell you what stage it's at or anything like that. So that was in 2019.
So what are the next steps from that moment?
At that point, I didn't want to have the surgery. I just wanted to kind of continue on. I mean, the pain was horrible every time that I would get my period, and that kind of 10 days before my period as well. But I thought that it would be, well, everyone, I've heard people tell you that once you fall pregnant, the endometriosis can be cleared. And I was like, okay, well, let's just try and fall pregnant naturally. We'll have all of the other tests and make sure that, you know, we're all in the clear. So didn't do surgery or anything like that. But it kind of got to 2.5 years or 2 years later, and we still weren't pregnant, and the pain was horrible. I wasn't able to exercise properly, or you know, even intercourse was really painful as well, which you need to have a baby. So yeah, it just got to the point where I was like, I think it's time that we do the surgery. And yeah, we did that in August 2022, and I'm so glad that we did, because it was stage 4. And, you know, 6 months after that, I felt like a new woman, which is amazing. And I can't believe I waited so long, but I wanted to be a trooper as well, and was hoping that I could kind of fix it naturally.
So you have the surgery and then you still want to fall pregnant. What were your next steps in terms of hoping to conceive? You were given a pretty grim outcome of your surgery.
After the surgery, Dr. Yazdani said, I'm glad that we did it, because the endo was like pushing up on both my fallopian tubes and overall other organs and stuff like that. So I said, let's just try naturally for 6 months so we can maybe try and avoid some of the costs that are involved with the IVF. And we did that. So August was the surgery. We tried naturally again, and it got to February. We were both like, okay, it's time now to do the IVF thing. So yeah, 6 months after the surgery, we gave it 6 months.
And having experienced endo surgery and then IVF, how would you describe, I suppose, those ongoing procedures and then your success with IVF?
I mean, it's a lot to deal with. I feel blessed that I had an amazing team in Anusch and Nurse Sam at Eve Health, and also having the support of Mike, even though there's obviously times where he doesn't even like truly understand what I'm going through, because it's like the hormones and then the pain from the surgery, but actually wasn't too bad. Like the post-surgery pain was fine, and all of that's manageable. I feel like I really tried to stay in a really positive frame of mind, but then you would get, once you started the IVF and all of the drugs and stuff like that, that's where it became pretty full on, and your mind kind of starts to do weird things because you can't control what's going on inside with all of the hormones and whatnot. But yeah, it's tough, but I think if you have a beautiful support network around you, you can do it. Yeah, it's possible. And at the end of the day, once you have the surgery, for me, it was amazing. Best thing ever.
Mike, it's interesting hearing Bianca talk. She's a warrior who wanted to do things naturally, told at the beginning of the journey, you probably have endo. And she was like, let's keep trying. I'm not going to have the surgery. And it's that idea that like, my body can do this. As the partner, how do you support her in that experience?
Hot water bottles late at night, bringing her drinks. So the pain that she was going through was ridiculous. And I mean, it was even from when we were first hanging out as friends, and she'd have issues and pain, and it got worse over the years. And I didn't even know what endometriosis was. I'd never even heard of it. And then when she started seeing Dr. Anusch, I came to understand it a little bit more and was a bit more sympathetic, because I understood that it was actually a thing. And to see her go through all of that pain and realize in hindsight now that she really didn't have to go through that. I'm pretty sure that she wishes that she did the surgery a lot earlier. And just little things on a daily basis. You know, we'd go for a run and she'd have, oh, my stomach's hurting. I've got to go run into the local toilets and could never find one. And there'd be a drama around that. But, you know, I mean, it's such a tough thing to go through. And then when she finally did the surgery, after we're already doing IUI and we're starting on our IVF journey, because it's a big thing to decide to do endometriosis surgery, and being told that you wouldn't even be able to have a child unless you did this surgery. So we're really, really lucky that we found Dr. Anusch and had the surgery done, because it's made our lives so much better.
We often don't think about the male perspective and even the journey of IVF, but you have a big role to play as well. And we are starting to talk a bit more about male fertility and things like that. You guys have been really open about your story with people, which I think helps others not feel alone. Tell me about that.
Yeah, I mean, obviously Bianca had the issues with endometriosis, and there were a couple other little things that she had to deal with, and I had to get my swimmers checked, and I had a low count. And so I had to cut the alcohol out as much as I was having, which is only a good thing. And I was also taking testosterone because, you know, when you get older, your body doesn't produce as much. And you know, better recovery time at the gym. I knew some other people doing it. And I thought, oh, great. You know, and I actually felt really good doing it. But apparently when you take the testosterone, it sends your sperm count to practically zero. So within a few months of stopping that and, you know, watching what you eat and drink, you know, good exercise, the swimmers came back, baby.
And we need those swimmers, don't we? You did successfully fall pregnant via IVF. What was the feeling like when you actually realised it's happening?
It was amazing. And then immediately I felt anxious. But yeah, I guess we had done 2 rounds of IVF before. The first one was a chemical miscarriage, or chemical pregnancy, they call it. The second one didn't work at all. And then the third one, and I had been really good because they tell you not to take pregnancy tests. But Mike had flown down to Sydney, and it was like the day before, so day 9, and you get tested on day 10. And I started bleeding a little bit, and I was like, oh, it hasn't worked again. I'm so heartbroken. But I was like, I'm just going to take a test just in case. And then little did I know that, you know, I left the test on the bench, and I came back and I looked and I saw 2 lines. And it was like the first time I'd ever seen 2 lines. And I just immediately started shaking. I was like, oh my gosh, I think it's worked. I called my sister, who recently had just had a baby, and my mum. I'm like, the 2 lines mean pregnant, right? So it was pretty amazing. And then I kept it a secret and got to go down to Sydney and tell Mike. But yeah,
you set up the camera in the bathroom. Come in here. Look.
Yeah, and I was so excited to tell him, and it was awesome. But then I think when you just go on such a journey to get there, then I just immediately felt anxious and sick. And the first trimester was probably harder than my entire journey, even with endometriosis. So
yeah, because you had a bit of bleeding along the way, and it was so stressful thinking, oh, is it working? You know, is it not working? It was the last embryo as well.
Last embryo.
So we're like, oh, what's going on? Is this a good thing? And Bianca loves this doctor. I don't know if you've met him. His name's Dr. Google. And it gives you a little bit of an anxiety attack every time you look up something, and it could be one of 10 things.
Well, to be honest, I didn't really use Dr. Google for that. I would call Anusch all of the time, and he was so amazing. And he said, just come in, we'll just make sure, we'll check everything's okay. And yeah, kind of all the way up until 11 weeks. I think I had like 3 times that I bled, and I would just go in. So he's been there from the beginning, and I'm just so grateful for that and for the team. But now I've passed that, I'm definitely more excited and joyful, and I can feel the baby kicking now, which is crazy. So it's pretty special. Yeah.
Well, we love hearing your story and having you share all of those experiences with us. It's a beautiful outcome, and congratulations to both of you. Thanks for joining us.
Thank you.
Thank you.
Thanks for having us.
Well, while there are physical symptoms of endo, it also has a huge psychological impact. And we welcome clinical psychologist Dr. Leesa van Niekerk, who also serves on Endometriosis Australia's Clinical Advisory Committee. Leesa, why should someone with endo seek help from a psychologist?
Thanks, Kendall. That's a great question. There are any number of reasons why someone living with endo may choose to go and see a psychologist. Now, in terms of seeing a psychologist, sometimes people might think, look, I have to go see a pain psychologist or I have to go see a clinical psychologist. But really, it's any psychologist with an interest and, skills in working with living with endo. So that may be a health psychologist, it might be a clinical psychologist, it might be a mental health social worker as well. So the reasons that you may go and see someone is often when GPs or gynaes are talking to you about seeing a psychologist, they may say, look, go along and see Leesa, she's going to help you work on the pain. Now, we can certainly work on the pain, but that's only really one tiny tip of the iceberg why you may come and see a psychologist. So often when I'm working with people with endo or their partners, what we're focusing on is the flow-on effect of the pain in all of the other areas of your life. So pain, if you imagine, is sort of sitting at the centre, but we know there's fatigue, there are other symptoms of endo. For, a lot of people, it impacts on sexual intimacy, it impacts on who they view themselves as in terms of the roles that they may occupy. That includes within the family system, within work, within relationships, within friendships, because we all wear so many different hats. So you may go and see the psychologist to talk about the influence that endo is having on your ability to manage at work. You may go and talk to the psychologist about the influence that endo is having on your ability to really engage with a particular sport or other activity that's really, really important to you, something that you really, really value, that you feel is threatened a little bit by some of the symptoms of endo. You may also go and talk to a psychologist about some of the trauma that has been part of your experience of endo.
We've been hearing about the physical impact of endo and fertility, and everyone's journey is so different. Can you tell us what you have discovered with endo patients who are embarking on their fertility journey?
Yep, certainly, Kendall. And as you've already just said, everybody's journey is so different, and the fertility journey is also very different for a lot of the different women and their partners that I see. So the first thing, that we often talk about is the uniqueness of their own experience. And sometimes that journey starts right back from their very first appointment with the gynae, where often the concept or questions around fertility are raised. For some people, they go, look, fertility preservation isn't something that I am focused on right now. I really just want to manage the symptoms that I'm living with and that are impacting me. For some people, again, the thought of becoming a parent isn't something that they've even sort of has crossed their realm of thinking yet. For others, it's something that's right at the forefront of their mind. And so it's really, really important that I understand where each person, whether they're coming individually or they're coming as a couple, sits within that frame. The next is, depending on how long the person has been engaged in that fertility pathway, sometimes we may also be looking at symptoms of grief. As I mentioned before, we may also be looking at some symptoms of trauma associated with that. I can remember one quote from somebody which said that, look, for years I've had endo belly and I've put up with people asking, look, how far along are you, when I've just been desperate to actually conceive, and having somebody ask me about, conception when it's endo belly is like picking a scab and pouring lemon juice on it. So again, for many of the women that I see, they may have symptoms like endo belly, other hormonal symptoms where it's felt like the one thing that I want to do is conceive. There are aspects now where people ask me questions, but I feel like I can't give them an honest answer. So a lot of the time as well, we talk about your story being your story and you having the right to share as much or as little of that story as you would like. Some of the other themes that we see come up, particularly around fertility, are what does it mean for me if my partner and I have to either go through fertility treatments, and whether those treatments are successful or not. Does that change who I am as a person? Because I've always seen myself as mum, occupying this role, parent. And so often when you're working with a psychologist around fertility, we'll also spend time looking at those sorts of questions. And, the other side of that, Kendall, is also for the partners, and also, as a couple in terms of the relationship sexual well-being. So often when you're on that fertility journey, the focus is more often than not on the outcome rather than the process of that sexual intimacy going through. So fertility treatments can have a negative influence on the sexual intimacy that a couple shares. So one of the things that we often talk about is making sure that the emotional intimacy, the physical intimacy doesn't fall by the wayside during the fertility treatment process, particularly in terms of partners having that active involvement. Because sometimes partners will talk to me about a sense of pressure to perform, to be available, and they're all things that they really, really want to do. And both members of the couple will talk to me about, that even if, for example, previously there was pain associated with sex, there was still a shared emotional and physical intimacy that we're losing now because the focus is so much on conception. So really what we encourage couples to do is to keep that fun focus going, to keep the emotional connection there so that sex is still something that is about an intimate connection between the two people rather than it being purely about conception or part of the IVF process, part of, sperm counts, donations and that sort of thing.
When it comes to fertility, what are the common psychological impacts for patients with endometriosis?
So some of the common psychological impacts include, a variety of things. So they may include feelings of grief. They may include feelings of disappointment. They can also include feelings of anticipatory anxiety and also of resilience. I think often we look at the downside of some of those psychological responses. But for some people going through fertility processes, there is also a sense of, actually, this hasn't been physically easy to do. This has been something that's been hard work for my body. And actually, it's shown me what a level of resilience I have as a person, the level of resilience that my body has, but also the level of resilience that we have as a couple in going through this process. What we notice is that the emotions can be cyclical as well. So depending on where you are in that fertility treatment process, where you are in that cycle, you may feel like, look, everything's relatively stable, but just when I'm about to go for the appointment, I'll notice a peak in my anxiety. Or in the lead up to undertaking a test, I'll notice a really overwhelming sense of anxiety or worry. And that's often when we really want people to start to use some of the skills that they may have learnt with their psychologist.
Is there a particular age where patients with endo tend to seek psychological help?
There isn't really a specific age that we see people with endo coming and wanting that support from psychologists. But what I would encourage is that it's not something that's left until the last minute. So particularly if you are a parent or a caregiver supporting someone with endo, encouraging engagement with mental health, as I said, whether it's a social worker or a psychologist, early in the piece is really, really important, because what the aim there is to learn some of the skills to create that buffer, given that we know our emotional well-being can go up and down at any given time. So really, adolescence is when a lot of people with endo start to notice some of those symptoms. And that's when we think it's an ideal time to be learning about pain science, pain education, mental health well-being. But definitely, if, for example, throughout your experience of endo, there's been any form of trauma, we'd encourage you to seek that psychological support as soon as possible, rather than leaving it and feeling like this is something I've just got to get through on my own.
What drew your interest to research around endometriosis in your field of psychology?
So, Kendall, what drew my interest in the research actually came from the experiences that I was having within the clinical settings. From there, I started to look at the research around the psychological impacts of pain. I'd actually done my PhD in non-malignant pain, and that really had focused mostly on lower back pain. And so pelvic pain was something that was new to me. But from there, I started to see more and more people who were living with one form of pelvic pain or another. And it became something that I routinely started to ask whenever I'd meet with a new client. And I was really surprised by the number of people who would say, oh, yeah, that's exactly what I've been experiencing. Or, well, I don't know if it's pelvic pain, but sex is really painful, right? Or, I don't know if it's pelvic pain, but I have a lot of difficulties with my periods or with fatigue or gut bowel based things. And so that's where my interest in the research really grew. And then through my role at the University of Tasmania within their postgraduate psychology training program, I was given an opportunity to start to really explore the role of research in endometriosis.
And finally, Leesa, what is the one thing that you recommend for anyone who is struggling with an endo diagnosis?
Well, the one thing that I recommend is that, particularly with endo, one of the things that we found is that for people experiencing that, they spend a lot of time getting really good at tuning out of their body. And what the research has shown us is that because that becomes a primary coping mechanism, it's almost like they try and disconnect from the neck down or disconnect from the belly button to the knees. And so what happens is their knowledge of their body, the way they view their body, unfortunately, it takes on a very, very different process. So they start to feel like their body is working against them, and it's something that they need to be in a constant struggle with. In some of the groups that I run, one of the questions that we often do is we look at doing a body scan. And at the end of that, the people in the group are asked, if you could acknowledge or be grateful for one part of your body, what would that be? And it's often a question that's met with, some grief response, some, gosh, I've spent more time than I can think of actually trying to not acknowledge anything in my body, that it's really, really hard to actually connect with it. So the one bit of advice that I would do is to spend some time acknowledging the strength and the resilience that your body has, particularly in the face of endo. So that doesn't mean, I think sometimes we look at statements like body positivity, and it doesn't mean, I have to be 100% positive about everything, because that's actually not the reality. But what it does mean is also looking at all the strength and resilience, the courage, the skills that it's taken you to help get your body to where it is. So it might be just acknowledging that, look, things have been tough today, but my feet have got me to where they needed to go. Things have been tough today, but my heart, it's pumped the blood through my system. So it's really just taking one small thing and acknowledging it, so it doesn't feel like you have to be in that constant struggle with your body. It's also acknowledging something that's really good when somebody else wants to shift the focus to the negative for you. So sometimes it might be thanking that person for their support, but also acknowledging to them that actually this is the strength and the resilience that I've had, that's got me through this. So it's not that I've had a great team of doctors or I've had a great psychologist. Actually, I'm the person who's got me through this. And I think acknowledging that, showing some self-compassion, directing compassion back towards yourself is something that's really, really important.
Well, Dr. Leesa van Niekerk, thank you for sharing with us. Your expertise and insight in this space is invaluable.
Thanks, Kendall. It's been great to chat.
Thank you for joining us for the 2024 Endometriosis Australia Symposium. We hope that you got a lot out of this. We've heard from experts in the field and also the patient perspective. And it's thanks to your donations that this symposium was possible. If you want more information, head to endoaustralia.org.